All right, let's get into it. For the last 60 years or so, the United States has been on this incredible journey to completely change how we handle mental health care. It all started with a revolutionary idea back in the 1960s, and it's led us to the complicated, super strained, but also really innovative system we have today. This is the story of that promise and where it stands right now.
Now that quote, it sounds like something out of a horror movie, doesn't it? But it's not fiction. It's the stone-cold reality of what mental health care looked like in America before the 1960s. For most people with a serious mental illness, the only option was being sent away to these massive, underfunded, and often just awful state psychiatric hospitals. The whole system was just ripe for a revolution.
And that revolution, it actually came. It was kind of a perfect storm, really. You had public outrage building, you had these brand new medications hitting the scene, and you had a president with a very personal reason to care about this. It all came together to create this powerful movement for change. This was the moment community mental health was born.
So how did this all happen? Well, back in the 50s, some brave reporters started going inside those state hospitals and exposing the horrific conditions. At the exact same time, new drugs like Thorazine were developed, and they showed for the very first time that many patients could actually manage their symptoms while living out in the community. This all came to a head in 1963, when President John F. Kennedy, whose own sister Rosemary had been institutionalized, put his full weight behind a new vision and signed the Community Mental Health Centers Act.
The sheer scale of what they were trying to do back then is just wow. It's all wrapped up in this one number, 1,500. That was the goal, to build 1,500 community-based clinics all across the country to replace those huge isolated state hospitals. The whole idea was to treat people with dignity right where they lived, not to lock them away. It was a seriously bold and humane idea.
But here's the thing about a big, beautiful vision. It needs a solid foundation to stand on. And almost immediately, this huge gap opened up between the promise of that 1963 Act and the reality on the ground. The system, as it was designed, well, it was never fully built. And this slide, man, it just lays out the fatal flaw perfectly. The federal government gave seed money to build the clinics and get them started, but, and this is a huge but, it didn't provide the money to actually run them day to day. That job was left to the states. So as the old hospitals started closing their doors, the new community clinics just couldn't handle the flood of people. It became this tragedy known as deinstitutionalization without community support.
And from there, the cracks just got wider. Through the 70s, states were really struggling to pay the bills. Then, in 1981, a new federal policy changed everything. Funding was lumped into these block grants. Now, the idea was to give states more flexibility, but the reality was that the total amount of money was slashed drastically. By the 1990s, that dream of a single, unified system was pretty much gone. It was replaced by this patchwork quilt of care, where your ability to get help basically depends on your zip code.
Okay, so let's fast forward to today. The system we have now is, well, it's a total paradox. On one hand, it's more integrated, it's more data-driven, and it's more innovative than it's ever been. But on the other hand, it's absolutely buckling under the strain of rising demand and a serious lack of staff.
So, what's happening right now? It really boils down to 5 big trends. We're finally moving toward whole-person care that treats your mind and body together. We're changing how we pay for it, rewarding good outcomes instead of just appointments. We're using evidence and data to see what actually works. And of course, digital health is exploding. But running through all that good stuff is one massive, system-threatening problem, a critical shortage of healthcare workers.
Now, the star of this new integrated approach is something called a Certified Community Behavioral Health Clinic, or CCBHC for short. The best way to think about it is as a one-door model. You walk through that one door and they offer everything. 24/7 crisis help, therapy, substance use treatment, you name it. And the most important part, they have to serve anyone who walks in, no matter if they can pay or not. There are over 500 of them across the country now.
But for all this great innovation, we're still facing a huge problem with access. I mean, look at this. 1 in 4 adults with a mental illness says they still can't get the care they need. That means millions, literally millions of people are falling through the cracks. And for young people, it's even worse. An absolutely staggering 60% of kids with depression get 0 mental health services. 0! It's a crisis.
So why is that gap so big? A huge piece of the puzzle is right here on this chart. We are staring down a massive workforce crisis. There just aren't enough counselors, therapists, social workers, and psychiatrists to meet the overwhelming demand.
The projections show we're going to be short nearly 100,000 professionals by 2030. It's the single biggest threat to all the progress we've made. So if you're going to take one thing away from all this, it's the paradox. We have built a system that's more modern and measurable than ever. But at the same time, it is deeply unequal, its staff is completely overworked, and it is still chronically underfunded. We're still grappling with the very same two questions from 1963. Who's going to pay for the care, and who is going to be there to provide it? And all of this, it brings us to right now. We are standing at a crossroads, a fork in the road, and the policy choices we make, right now, in the next few years, are going to decide which of two very, very different futures our mental health system is going to have. The stakes really couldn't be higher. So what do those two paths look like? Well, let's call them Path A and Path B. Path A is where we double down on the reforms that are working. CCBHCs expand, tech helps us reach more people, and we finally solve the workforce crisis. It's the 1963 vision, finally made real. Then there's Path B. This is what happens if funding gets cut or major health laws are repealed. We'd see a return to that broken, under-resourced patchwork of the past, with a system that only has enough resources to deal with the absolute worst crises. And if you want to see what's really at stake, this table just lays it all out, side by side. In one future, we get more clinics, more access, and a focus on preventing problems before they start. The funding is stable. In the other, we get widening service deserts where there's no care at all. The only care available is crisis care, funded by unstable grants. And the bottom line? One path means millions of people get to keep or gain coverage. The other means millions lose it.
At the end of the day, it all comes back to this. That promise from 1963 was so clear and so simple. Accessible, community-based care for every single person who needs it. After 60 years of progress, setbacks, and hard work, the question for all of us today is, are we finally going to be the ones to make good on that promise?